Well, hi, everyone. My name is Jeremiah Betchen with the Bar and Restaurant Group. As you have been following along with our coronavirus coverage, we want to continue to help you stay informed on how to plan during this pandemic and also what the other side looks like. QuestX as a whole is a parent company that oversees Bar and Restaurant. We are lucky to have Fierce Healthcare, Fierce Biotech, and Fierce Pharma as part of our portfolio that is covering this more from the medical side and the healthcare side. So I'm joined today by one of my fellow editors of the group, Tina Reed. She's the executive editor for Fierce Healthcare. Thanks for joining us today. And so this is meant to be short, just a few minutes to kind of distill what's happening in the industry, especially from your point of view and when businesses might think they can reopen. So that really is the multi-billion-dollar question with so many places shut down. Do you have any indication from your perspective on when might business expect to reopen?
So it's obviously, as you said, a billion-dollar question. It's interesting. I'm a healthcare journalist, and I happen to be married to a guy in the restaurant business, and this is the question that he is asking every single day. And we don't know exactly when things are going to reopen. As things stand now, the coronavirus task force has been working with the date of April 30th being how long we're going to keep our current restrictions in place. And we'll kind of revisit when that date comes up. But it's going to obviously, it appears to be state by state that we're really going to be following this. And so obviously some states like Washington, got hit earlier than places like New York, which is just New York and New Jersey are dwarfing the rest of the country. And so those might come a little bit later. So it's really going to just depend on where folks are in the country.
Yeah, I mean, you mentioned New York, which sadly has lost over 10,000 lives to the coronavirus so far. Their schedule is going to be so much different than Wyoming, which only has a single recorded death affected by that. So, yeah, I mean, it has to. Even Dr. Fauci kind of said this will be almost done region by region. Something that the governors have kind of also announced yesterday, that 7 states in the Northeast, Massachusetts, Delaware, Pennsylvania, New York, New Jersey, and Connecticut, have all kind of formed a pact. And we saw the same thing happen on the West Coast with California, Oregon, and Washington. Do you think that, them having these announcements in advance is going to help us have a little bit more insight into when they might reopen and how much notice they'll get? Because the shutdowns were kind of fast and furious for those early hit states. Many places had kind of stocked up for St. Patrick's Day, so they had a lot of inventory on their shelves. And now all they do is they have no cash in their drawers because it's all sitting through inventory. Do you think we're going to get a little bit more notice on what these kind of gradual reemerging from stay-at-home orders will look like?
I think if nothing else, it'll at least help people kind of read what's going to happen a little bit better than how things close down. Because if you remember, like just being in the DMV area, Virginia, DC, and Maryland all had different dates when things were getting closed down. And while they were kind of following each other, I feel like having this pact and having the governors really work together is going to kind of help people better understand how they're going to be reopening and what sort of timetables they're going to plan on using as they do start to slowly open things back up.
Yeah, that's good insight. And so when we do reopen, I mean, what do you think business looks like? I know some places in California and New York are requiring masks, especially in the healthcare space. We saw Smithfield had to shut down their entire factory, and so there could be a pork shortage. What is the ramifications of basically operating your bar or restaurant almost like a healthcare office and knowing that people could come in contact with this?
Well, the thing that Dr. Fauci on the coronavirus task force keeps talking about is that it's not going to be like flipping a switch. And that's what we've seen in other countries as well is Beijing is one of the key places that's been opening up. And, folks are still wearing masks. They're still social distancing. They can't have big parties or gatherings. This seems to be what all the European countries are doing as well, as they're saying when we open back up, it's not going to be back to business as normal. We're going to still have to be careful. In Beijing, actually, it was interesting. The Wall Street Journal did a video of what it looked like, for instance, going into a restaurant. And while the restaurant had a ton of seats open, they weren't allowed to actually go in and sit down until some more people left because it was just so limited in terms of how many people were allowed to be in the restaurant at a single time. And then when the restaurant workers went to the table, they were just cleaning that entire table off very visually in front of the customers. And I do think that's something we'll probably end up seeing a bit of here.
Yeah, I mean, talking about reopening, we know that Hong Kong, almost 2 Fridays ago, had to re-shut down almost 1,200 bars and restaurants because once they kind of opened the floodgates, people were packing into bars, and they had a spike in cases, and they saw that at least over 60 of those cases had visited a bar or restaurant, which is why they targeted that type of business to shut down. They left salons and some like gyms open, for example. So that's something a little different that we saw here. So Data Central is another research company that puts out a lot of good insights. They surveyed over 1,000 consumers on what they were most comfortable going to, and going to a restaurant was actually pretty high on the list. Going to a bar or a nightclub, a more packed, condensed area, was actually pretty low in terms of feeling uncomfortable. But the good thing for this business is the number one thing that people were most likely or wanting to do is visit their favorite bar or restaurant. So it's good to see that. A little surprising. It was more than sports venues. It was more than even seeing families and friends. So, and then I do want to kind of talk about the fact that there's a lot of information out there. So, what do you guys like to follow? Who are the kind of the trusted sources? Because I think it's important to focus on what you can control instead of being kind of consumed with all this news, which a lot of it is, hypothetical. These are all models that, they're only as good as the data that's going in, and it's a completely changing based on people actually following social distancing. What should people check out that kind of have 2 or 3 good sources to look at?
Definitely, Johns Hopkins University Coronavirus Resource Center has been something that consistently, it seems like everybody is following the database that they have been putting out there because it's been very reliable. The Institute for Health Metrics and Evaluation at UW-Medicine has also been one of the models that has been consistently reliable and has some pretty interesting projections. And then the New York Times actually put out a model that I found very interesting and helpful that was put together by researchers at Columbia, and that's also something I recommend. Further, we look at the Centers for Disease Control and Prevention for their updates, as well as the World Health Organization.
Yeah, 5 very, very good resources. I like to follow the IHME as well. They're funded by the Gates Foundation, and they update it almost every few days with the projections, which again, our projections. I think their current peak date, has passed. They're also showing that we should be under the need for a lot of our ICU resources and ventilators, which is a very positive sign. I think the total death count for them by August 4th or 5th is about 63,000, which is much lower than early indications of 100 to 220,000, and even bigger from other models. So the good thing is the sacrifices you guys are making by shutting your bars and restaurants down, it is having an impact. These governors from a state level are doing the delicate balance of livelihoods versus lives, with the latter being the heavier kind of weight on the scale accordingly. So, Tina, thanks for your time so much today. We appreciate it. We'll reach back if we need more news.
All right, thanks.
Welcome.